All right, so thank you everyone for being here today. I'm going to talk a little bit first about my journey, my academic journey, and then I'm going to talk about some preliminary results from the first study, which is a study about food insecurity responses, solutions, and transformation during COVID-19. So I'm going to get started by talking a little bit about how I got to where I am. And I was reading today and getting prepared for teaching tomorrow. I am teaching our internship course in YFCS right now. And we're going to be talking about the praxis cycle. And so I was reading some of Paulo Freire's work and bell hooks, and they both talk a lot about how lived experience shapes theory. And for me, I could start my journey in a lot of different places, but for me, when I think about how I started studying religion and health, it's some of that is rooted in my own lived experience. And it's not my own experiences of mothering, but it was an experience that I had when I was in doing my master's program, and I went to see a friend of mine who had just had a baby, and she was struggling with some postpartum depression. And it was just kind of a very eye-opening time for me as a young person to see my friend going through this and to see the changes in her body and her life that mothering had brought. And I went back, this was in my first year in my master's program, and I went back and I wrote a thesis that was like a very theoretical feminist theory thesis on pregnancy and embodiment. So that was when I kind of started thinking about these intersections of religion and health and how they're connected. But I also, at the same time, I got a job, a temporary job in between my 2 years of my master's program at the Division of Public Health in Raleigh. And I was an administrative assistant for the Women's and Children's Health branch. So that's the branch that oversees the WIC program. So I was thinking a lot about mothering, and I had this temporary job because my mom was like, oh, you should work in public health. They've got these interesting positions. And I fell in love with public health, which is not something that I didn't know anything about. I studied religion, and I was a women's and gender studies double major as an undergrad. That was what I was focusing on in my master's program. But I sort of fell in love with public health in the work of public health. And so that administrative position that I had, and mothering I've started to realize, been this theme in my academic career and also now in my personal life as well. When I finished my master's degree, I decided that I wanted to work a little bit, and I stayed in public health. I was lucky enough to get a position again with the Division of Public Health. And that was where we actually developed the Faithful Families program, was when I was working in the division. So that program has been around since 2007. And I started it in the Division of Public Health, and it was always a partnership with Extension, but now it's been really great to be able to be on the Extension side of that. And my colleagues and my mentor, Kathy Thomas in public health, when I said I wanted to go on and do more graduate school, it was really hard for me to decide if I wanted to go into public health formally or if I wanted to study religion. And I was lucky enough to find a program at Emory where I could focus on both. So I, as Dr. Donaldson mentioned, I was in a program called the Religion and Public Health Collaborative at Emory. And so I was able to kind of focus in my discipline on religious studies. I was also a certificate student in women's and gender studies. But I worked my whole time at Emory, and being a part of this collaborative, I did so much work with scholars and faculty in Rollins School of Public Health. And I was really shaped by that work with faculty at Rollins, including one project that I worked on for a lot of my time at Emory, which was called the Religion and Reproductive Health Project. And I spent 2 years doing ethnographic research in a homeless shelter in Atlanta, really talking with women about mothering and about their experiences as mothers, and about their reproductive health histories and journeys, and really listening to how for many of the women we talked with, their kind of sense of religiosity shaped how they thought about mothering, how they thought about their reproductive health in a very lived, concrete way. So at the outset of this particular study, they were interested in seeing like, does a person's religious beliefs or experiences shape the reproductive health decisions that they make? And what we found as a part of this project is that it's really very complex, and the ways that people think about reproductive health or mothering and its relationships to their religiosity emerged in the course of their life course and in the course of their narrative and in the course of their history. And so, for example, ideas like blessing and how like pregnancy or mothering is a blessing, even for women who were doing that kind of mothering in very difficult circumstances. And so that was the first project that I was able to work on that was really multidisciplinary, interdisciplinary, but it sort of has rooted and guided the kinds of work that I enjoy doing, which is focused on how people make meaning out of life and how people cope and demonstrate resilience in the midst of some really hard and difficult circumstances. Also at Emory, I was able to, as I mentioned, I also did women's gender and sexuality studies. And so as a part of that, I was able to travel to Liberia. Emory has a relationship with the Carter Center. Jimmy Carter's presidential library is there, and the Carter Center, which if you know, does incredible work around human rights and peace building all around the world. And so the Carter Center was doing a lot of work in Liberia around post-conflict violence and transformation, and around gender-based violence and trauma. And so since I had done this work on the reproductive health project and I was working in women's and gender studies, I was able to go to Liberia and talk with NGO leaders and with women about the work that they were doing around gender-based violence post-conflict. And a lot of that work, I again was listening to and learning from and hearing about how women were processing experiences of trauma and violence through a kind of religious lens, or in some cases through religious practices. And I don't know about everyone else, but I feel like my academic journey has been this series of really lucky opportunities and chances of meeting people and kind of being in the right place where I was able to become a part of something that I wouldn't necessarily have thought that I would have been a part of at the beginning. So for example, I didn't start out my PhD program thinking that I was going to study conflict, violence, and trauma, but that was really the focus of my dissertation. And that was as a result of meeting faculty and meeting these incredible women leaders in Liberia and back in Atlanta and also in North Carolina who were doing this work around trauma. And so that was the focus of my dissertation. I did ethnographic research with a Liberian church here in North Carolina. And my focus was on how kind of the everyday practices of lived religion were some of the ways that people experienced healing in the aftermath of experiences of severe conflict and trauma. And so as you'll see, as I start talking about our first project, the focus of my work has really been on listening to people's stories and centering stories and narrative and thinking deeply about how people cope and demonstrate resilience and even find like hope and experiences of thriving and joy in the midst of these experiences of hardship, or in some cases even trauma. And so after I finished my dissertation, which is not the advice that many folks like to follow when you're finishing a PhD program. Usually the advice is you go where the job is. For me, I did my master's in Nashville and I did my PhD in Atlanta, but home is North Carolina. My family is in Harnett County. My husband's parents are from here. Here's home. And so I wanted to come back to North Carolina, and I was lucky enough to still be connected with the Faithful Families program, and to learn about, actually from Dr. Dunn, that there was a need for a project manager in this department for a project called Voices into Action. And that was a 5-year longitudinal study of the family food environment in 3 counties in North Carolina. And it was headed by, at the time, Dr. Sarah Bowen. Eventually, Sarah and Dr. Seneca Elliott and I shared co-PI responsibilities on that project. Kim Eshelman, who's on this call, was our project manager and part of our leadership team as well. And so I came here as a project manager and right out of graduate school, and then kind of gradually started teaching in the department. I teach our sexuality course in YFCS, and have been able to apply for and become a part of the tenure track faculty here. And a part of that has been, like I said earlier, about just kind of following and listening to and trusting my instincts to think that, like, this is interesting and that's something that I want to follow, but also thinking about my own self and who I am and what I need out of this. And so I'm saying this to graduate students because my committee members were terrified that I was taking this position, but I knew that I wanted to be back home in North Carolina. And it doesn't always work out for everything and everyone, but in this case, like, I had to listen to that. And so, and I'm really glad that I did, because I love our department and I love the work that I'm able to do here. And most of my work here is focused on this kind of intersections of food and health. And again, being attentive to how people make meaning. Food is one of those things in our lives. It's a part of who we are for so many of us. It's our cultural, it's a part of our culture and how we experience our identity. And it's also, I have learned a lot over these projects that I'll talk about how families, in a similar way to what I was talking about earlier of, you know, having worked with survivors of gender-based violence and women who were experiencing homelessness, a lot of the families who we've talked to, either in the Voices into Action study or in this first project that I'm going to tell you about now, for them, coping and thriving, there's a lot of religious language and practice and belief that's underneath how people kind of process their experiences of food insecurity, of poverty, of precarity, and the pandemic, honestly. So that's what I'm going to talk about today, is a project that I've been working on with Dr. Sarah Bowen in the sociology department, Kim Eshelman, who's also our project manager on this project, as well as a large team of folks in 5 different states on food insecurity during COVID. And that project, we have 5 other universities who are part of the project. It's funded by the NSF. Clemson, Michigan State, Mississippi State, NC State, and South Dakota State are a part of the project. And I will, in the slides in the end, I have all the researchers' names and photos there. But I first do want to acknowledge that this really has been a very collaborative project, and I love being a part of this kind of collaborative work. I think that's another thing that's been a part of my academic journey is, in addition to following things that I find interesting and compelling, it's also been about finding people who value and honor humanity, and value and honor and center things like care and concern for one another as a part of our research. And I really have been very lucky to be able to work with people who are good friends and colleagues as well. And Dr. Haynes Maslow is also on this first project too, so I don't want to leave that out. Okay, so to transition to first, I want to give you all a little bit of background on food insecurity pre-COVID and also food insecurity rates during COVID. And then I'm going to talk about some of what we are hearing, some of our preliminary results of this study. So some context first. After remaining relatively stable between 10 and 15% for 2 decades, food insecurity rates more than doubled overall at the start of the pandemic. So in this kind of like spring 2020, tripling among families with children, according to 2 nationally representative quantitative surveys, the COVID impact study, and the Hamilton Project, the Future of the Middle Class Initiative survey of mothers with young children. So besides the dramatic overall increase in food insecurity at the outset of the pandemic, there are a few important things here to note. The first is that there was this big jump in food insecurity among families with children, and also among thinking about childhood food insecurity. So that's the orange, that orange line at the bottom. And this is significant because a lot of studies, including our Voices into Action study, have shown that parents do everything they can to buffer children from the effects of food insecurity, such as skipping their own meals and eating less so that children have enough. Another notable issue is that there are large disparities by race and ethnicity in these numbers. Data shown here from the COVID impact study, COVID impact survey in April of 2020 shows that Black and Latinx families were more likely to report experiences of food insecurity at the start of the pandemic. And there were differences by income as well, which I don't have up on the slide here, but families who reported lower incomes were more likely to report food insecurity. However, for those of you who have been following this, you already know this, there have been some good news in 2021. After staying stuck for months, food insecurity rates really began to decline dramatically starting this past March. And that came after several influxes of money from the federal government. So an increase in SNAP benefits in January 2021, and the third round of stimulus checks. So you can see here on this chart. And according to the just released USDA data on food insecurity, the 2020 prevalence of food insecurity was unchanged from 10.5% in 2019. So although we saw this like dramatic increase at the beginning of the pandemic, we can see that the stimulus funds have had, the stimulus funds and the increases to SNAP benefits have had an impact on families' lives. And they show the power of the federal government in preventing and reducing these kinds of hardships. At the same time, it's important to note that even with those decreases in food insecurity that the USDA has recently reported, the USDA does note in the September report that the prevalence of food insecurity has increased for Black households from 19.1% in 2019 to 21.7% in 2020. And it was also higher for households in the South. So you can see here, this is a chart from Feeding, or a graph, not a graph, a visual from Feeding America about how place matters in terms of food insecurity and rates of food insecurity. Many of the places in our country with the highest rates of food insecurity, some of those with the dark blue, are also places with large shares of people of color. And we know from other research done during the pandemic that people of color are more likely to have lost a job during the pandemic, to be less likely to be able to work from home, are more likely to have gotten COVID or know people who have been hospitalized or die from COVID. And there are disparities in terms of vaccine adoption. So combined with this, many programs, many federal programs, including food assistance, are implemented at the state level. And one of the things that we've learned in the first study is how these variations by place really matter. So different states have had different timings in terms of distributions and their implementation of some of these pandemic relief programs. And so our study, this first study, is really seeking to understand this to hear from people about their experiences during the pandemic and to think about what life has been like in terms of food and food insecurity. And so we want to provide a more nuanced picture of the families behind these numbers and data that I've been talking about before. It is a primarily qualitative research project. We've been conducting semi-structured interviews over Zoom or over the phone. We've also used photo elicitation. So we've asked participants to take photos of their food environment or the foods that they're cooking. And we have two phases of the project. So the first phase was started in late September of 2020. And in that phase, we conducted 2 interviews with the participants. The first one was kind of like a general interview. We did do a short survey, including the USDA's food insecurity questionnaire. And then the second interview was that photo elicitation interview that I was telling you about. So we had participants take pictures of their food environment, and then we talked with them about those. We've focused on families with children between the ages of 5 and 18, since this is one of those groups that's experienced the biggest increases in food insecurity. And so this means that we can't say a lot in our study about the experiences of other groups like older adults who have also been very hard hit by the pandemic. We're currently finishing up phase 2 of our study, which is a follow-up interview with participants. And so we're seeing changes, or so we're seeing differences in the study in terms of place, but also understanding changes over time. So what's happened as children have been in and out of school, as families have gained or lost jobs during the pandemic, and also how experiences of COVID itself, like whether or not families were impacted by the virus personally, and how that impacted their life. And so our overall research questions are here. What are the impacts of COVID-19 on household food insecurity, and how does place shape people's experiences? We are really aiming to communicate out this research as quickly and as transparently as possible. So we've already done some workshops with extension professionals, and we have been working on developing some outreach pieces. Dr. Haynes Maslow is going to be doing like a workshop on policy, and we're doing lots of things in our research team to try to get this work out as quickly as possible, because elevating these lived experiences is really important, and telling these stories because they have the potential to shape policy. So here's some of our preliminary findings from the study. And these beautiful graphics were created by Kim Eshelman. So I just want to say thank you to Kim for creating the graphics here for our project. So some of what we found is that essential workers have really disproportionately suffered from the pandemic. So these are people who have been on the front lines: retail workers, folks working in schools, folks working in healthcare, and they have really had to deal with not only the stresses and conflicts over their own work situations and their risks in their own families, but also the ways that they have been treated, or the conflicts that have emerged in their communities around things like wearing masks. So for example, Deborah is one mom we talked to. She's 47 years old, a Black mom, single mother who works as a custodian in a local rural school district. And she really was on the front lines of COVID. And so she was one of the people who was cleaning the buildings after, if somebody tested positive. And despite the fact that she herself was delivering school food, so she would go out on the buses and help deliver school meals to children, she couldn't actually make use of them for her own kids because the pickup times were during the day and she was working. And so her older kids were home doing virtual school while she was out delivering meals and couldn't access that. That's actually something that we heard quite a bit from essential workers and people who were working on the front lines, is that it was very hard for them to take advantage of things like food pantries or school meals because they were working. And so they would have, neighbors watching kids or things like that. So that made it really difficult. School closings also had a big impact on families. And I know anybody who's here on the call who has had children at home, we know how difficult that has been. And moms took on a lot of that extra work of watching kids and supervising virtual schooling. Another mother I spoke with, Monica, is a white mom who lives with her husband and her 6-year-old daughter. She actually was a substitute teacher. And so she thought that doing virtual schooling would be easier than it was. But she said that being a full-time mom and a full-time teacher to Anna, who was in 1st grade, was really difficult. Anna had a lot of trouble concentrating, and Monica didn't feel like she got enough support from the school to manage it. And so she was doing all that she could to try to keep her active during the day as a 6-year-old being home. But Monica's biggest challenge was the mental health for everyone in the family. Her husband, Dan, was recently diagnosed with a mental health illness or a mental illness. And she worried about his mental health, but she also just really worried about herself. And she said she felt like she had no space and time to herself. She had no balance, and she was, quote, mom 24/7. And then finally, compounding challenges. A lot of families just kind of experience multiple stressors, one on top of the other, and of one crisis after another, including Shauna, who was a 25-year-old Native American mom of 2, who during the fall of 2020, which was before we talked to her, had a job at Macy's. Her husband had a manufacturing job. They were doing okay, but her husband got COVID in the fall of 2020, and it quickly spread in the household, and Shauna was pregnant. She had to leave her position at Macy's because she was not able to take enough leave. And she ended up with pneumonia in the hospital on a ventilator. She was one of the many folks who talked with us about how her spirituality helped her to cope in that situation when she was worried that she or the baby might not make it. And so that particular experience really compounded the stressors of the family, because it was the health issue that then led to financial precarity, that then led to housing insecurity, and that then led to the family losing their home. And they lived in a homeless shelter for some period in the fall of 2020. When I talked to her in March of 2021, they had gotten housing through a rental assistance program in their county. And she was really thankful for that particular housing program. And she had just had her baby, who was born, and she said that was her proudest moment of the pandemic, was having her baby girl be born and healthy. And so Shauna's family really experienced these kind of compounding precarities: housing, food, financial insecurity, that shaped the lives of many of the families in our study during COVID. We also learned a lot about how federal food assistance programs were a real lifeline for a lot of the families in our study. I didn't mention this earlier, but everyone in the study, all of the families in the study were at or below the poverty level. And so we heard a lot about how programs like SNAP or PEBT, which was the program that allowed families who receive free or reduced lunch to get EBT funds to be able to purchase food while the kids were out of school, and that program has been continued. So for example, Lauren, who is a mom who lived she's a grocery store cashier in a rural county. She really struggled to keep food on the table, and her SNAP benefits were a vital lifeline during this time. She talked to us about, as many families did, about the ways that they were stretching their food dollars. So she talked about having oodles of noodles be a real lifesaver for her, and using $20 to hold you off for a week of buying things like oodles of noodles, Vienna sausages, snacks, snack foods, and bologna to be able to kind of get through the week. Or buying large staples. So several of the families used their stimulus checks to buy freezers. We found this also with Voices into Action, where families would use their tax refunds to buy deep freezers, and then families were using those to save foods for the long haul. So she would stock up when she found a good deal in the grocery store. And because she worked in the grocery store, she was really able to shop the sales and get things when they were on markdown. The hardest time for Lauren and for other families in this study was the last week or two before they would get their SNAP benefits, which for her were deposited in the middle point of the month. And then emergency food, so where the federal government response, when people needed additional support, they would turn to places like food pantries or school meal delivery programs to fill some of these gaps. And families were really grateful for the support, but there were also some challenges related to emergency food during COVID, and those still continue. So some families, expressed that they were not able to get the kinds of foods that their family needed at the food pantry, or that they received foods that were not culturally appealing for their family. But other families really talked about the ways that school meal pickup services were really helpful in reducing the feelings of shame that they sometimes felt in going to a food pantry pre-pandemic, because the school meal programs where families could go and pick up either a meal or a box of food, they were open to everyone. So there wasn't the same kinds of feelings of shame that families have talked about in other studies that we worked on, or even they told us this in this study. So having it open to everyone helped them to feel like they could participate. And as it says here, the most useful programs that we heard about reduce barriers to access and provided a variety of foods. And then finally, in our terms of our preliminary findings, I want to share that even we tried to draw on in the interviews, even though they're very difficult and they've been hard conversations to have with people. We also talk a lot about strengths and where people find joy and where they find hope. And we haven't analyzed all of the data yet. So as I said, these are preliminary findings, but it is very rare to have an interview where you don't hear someone talking about the ways that they're showing up and helping and supporting other people in their community and their families. So every one of the participants who I've talked about in this presentation so far have done this. Sharing food that their families didn't eat with friends and neighbors. So Monica did that with the school meal boxes that she received. Lauren and her family cooked dinner at a local soup kitchen on Thanksgiving. Deborah, who I talked about earlier, would bring food for kids she saw at school who were struggling or help them with their homework. And Shauna told us, and several others have as well, about that the biggest support to her during the pandemic has been a mutual aid Facebook group. A stranger, someone she didn't know, sent her family food and money during her COVID hospitalization. And so she and her husband have been paying that forward now. He's a mechanic, and so they offer like free mechanic services to people who are a part of that Facebook group. I put here a link down. Lindsay, Dr. Haynes Maslow and I have been a part of another national study about COVID. And she led this paper. So if you're interested in more about how people are doing so many things to be there and to show up for others in their community, this paper is about exactly that, in particular in North Carolina. It's not related to the first project, but it's another study about how people are showing up for each other. So in terms of conclusions, as I mentioned earlier, it's really our goal with this project to take what we've learned and to share that with the communities where we're working. We've also tried to be very reflexive as researchers in this process. And we're currently sharing information back with participants about what we've learned, and listening to them and seeing if we got it right, if we're hearing their stories the way that they have narrated them. We've also, as I mentioned, held workshops with Extension and food pantry professionals at several points to share the results of this work. And we're working hard, and I'd be happy to talk more about this either in this presentation or offline later, about creating transparent and participatory writing agreements for folks on the team, so that researchers who are part of the project, from graduate students all the way to we have someone who's a dean on our project team, can work on the data and write a paper and share results, whether that's an op-ed or whether, however they would like to share those results. And so I'm more than happy to talk at another point about reflexivity and power and research, because we haven't always gotten it right, but I think that's something that that has really shaped me as a researcher and being a part of this project, and a lot of that has come from the folks on the project pushing us to continually think about power and to continually think about reflexivity and how we are doing that in this research, as we center justice and equity in the work that we're doing. And finally, I just want to say thank you. These are just photos. You can see these on our first website, but these are photos of our research team, and you can see everyone's name here. It really is one of the most collaborative research projects that I've ever worked on, and I'm really, really happy about that. And here's information about the study if you'd like to learn a little bit more, but I will let that be the end of my presentation and open time for questions. Thank you all so very much. And if anyone has questions, you're welcome to ask her.
Thank you so much, Dr. Hardison-Moody. In regards to methodology, what advice would you offer for graduate students interested in ethnographic research? That's
a great question. I don't know that I have great advice, but I will tell you what I did, and that is I made myself a friend of anthropologists, and I took courses in anthropology, and I worked on that reproductive health and religion project with anthropologists, and so they trained me both kind of theoretically, and I did coursework in anthropology, but also practically. And one of the most beneficial things that I did was Iman Rushdie Hamidi was the PI on that religion and reproductive health project. And I remember talking to her about, feeling like I had tried ethnography in a research methods course as like a, going out and doing something and then writing field notes. And so I felt very nervous about it. And so she really, she went with me and we did a couple of interviews together, and just kind of like modeled what it is to do field work and to do the kind of like engaged, caring field work that we want to do. And so it was both of those things that were really beneficial to me, both like doing coursework in ethnography with anthropologists, and then also being kind of practically trained in doing that kind of field work. And that I just did as being a research assistant on that project.
Thank you very much. The next question comes to us from Christian Woods. He writes, I would love to hear more about the community systems that created themselves throughout the pandemic. I heard about the mechanic paying it forward. Are there any other stories like this in the paper you spoke of?
Yeah, there are we heard a lot of examples of these kinds of like either social media mutual aid groups or kind of neighborhood groups. People would, for example, like if there was a food pantry giving out food pantry boxes and somebody in their neighborhood heard about it, they would get extra boxes for people in their community and then take them back for people who might not be able to go and pick them up. And then these mutual aid Facebook groups, people talked about how beneficial they were, because just being able to connect with somebody and have someone respond, like in Shauna's particular case of like somebody hearing her story and then directly sending her family food and money. And she was not the only one who that was the case for. But in some cases, it was like these very informal, and I'm thinking about the families who I profiled in this, but this is like, they're emblematic of the other kinds of stories that we heard. But like Monica, for example, her daughter didn't like a lot of the school meal lunches. And this was very common. Like anybody who has kids knows this, like kids can be very picky about what they eat. And so the kids would get things in their boxes, or they would get things in their meals or in the food boxes from school. And so moms were continuously like sharing that with somebody down the hall. Like Monica told me, she was like, well, I have friends who are older adults who don't have kids in the home. So when I get something that Anna won't eat, I take it down to them. And we heard that time and time and time again. And I think that speaks to something that I learned when I was at Emory and a part of the what was then called the African Religious Health Assets Program and is now called the International Religious Health Assets Program. And one of the things that project has learned is they try to investigate, like, where do health assets live, and who do people trust, and what do they value in their community? And what they have learned through this project of community building, community trust, is that a lot of times, like, outsiders, researchers come into a community and we think that we understand the assets or the resources that a community has. But what the Our HAP and EarHAP projects have done is supported and upheld the work of local communities to identify their own assets and to build out the work based on those indigenous assets that they see in their communities. And when they develop from that model, you see all of these things that previously seemed invisible. And that has what made me think about like these mutual aid groups and things like that. Like when we're thinking about COVID response, a lot of times we do think about these kinds of big programs, SNAP or food pantries and things like that. But when people talk about the things that they've done at a granular level, like there's so much happening. It's like these little spider webs that just emerge out, but that might seem invisible if you don't kind of listen and uncover those.
Thank you. To follow up on Christian's question, you mentioned federal food assistance and emergency food programs. In phase 1, have you noted any differences among the counties? As an illustration, as we know, Halifax and Wake are two totally different places. So in regards to the federal food assistance, emergency food programs, or any other aspects of food insecurity, have you noted differences?
Yes, we have definitely noted differences in, I actually was just talking to a mom from South Dakota recently, and there have been big differences, like I mentioned earlier, in terms of like when programs were implemented or how states have implemented. Dr. Haynes Maslow, like this is her specialty. So if there are things that I'm saying that are not right, she can step in. But from a participant level, we have seen big differences in terms of how the governors in these states have had a lot of impact over how these programs have been administered locally and how that has impacted families. So for example, the governor in South Dakota has had a bit more of has not had as open arms to federal pandemic response, I will say. And we have the families that we've talked to in South Dakota have felt that. They have felt those things, and so yes, so we do see those kinds of differences of where when you have a federal, and this is what this mom that she was talking to me about last week, she's like, I don't understand how a federal program, how my benefits or what the support that I get looks so different from how it does in other states. And so this is where you see like those differences by place, they really do matter. And then the other differences that we see by place are in terms of like resources that people have. So in more urban counties, we've seen that families have a little bit, it seems like they have a little bit more knowledge about the kinds of resources that are available in their community or ways to connect with, whether it's DSS or whether it's a food pantry, whereas in our rural communities, they really do not. And so, and that's where I think, and I've been able to do that even in Halifax County, of like putting people directly in touch with Extension and the ways that our Extension agents can really help support families and help them to find the resources that they need. I've sent resources, for example, for More in My Basket and for SNAP outreach programs in North Carolina, and connected people in other states, our participants. Because I think in the more rural communities, they have had less access to food pantries, and also those food pantries are not open as often as they are in the urban places. So good. So I didn't get it wrong. Thank you.
Next.
Oh, sorry.
I just wanted to, I did not want us to miss Christian's question around, will we get these slides or just the recording?
I'm happy to, yeah, I'm happy to share the slides. And then Christian, you had another question about food insecurity in Liberia and North Carolina. It's a really interesting, it's a really interesting question. And it's one that I haven't thought a lot about in terms of food insecurity. I thought a lot about that because initially my dissertation was going to be a comparative look at gender-based violence and thinking about how survivors think about healing in a post-conflict setting and then in the United States. And so I thought a lot about like that piece of it and how there are things that I feel like there are things that I learned from women who are running, whether it's like informal shelter programs or trauma healing programs in Liberia and vice versa in the US, and like how there are a lot of things that we can learn from each other. But I haven't thought about food insecurity, and so I'll think about that. And I don't know. Oh, and I didn't see Beth Edwards is on this call too. Beth is one of our YFCS master's students, and Beth is also part of the first project. You probably saw that earlier. Sorry, Beth, I didn't call you out. I didn't see you there.
What additional questions do you have?
I'll just ask this to Dr. Hardison-Moody. I'm curious. So you've had a lot of tough conversations and had to listen to a lot of stories. So as an individual and a human being yourself, do you have advice for students or other researchers on how to be involved in sensitive questions and having to listen to these stories over and over again, but also almost protect your own type, your own mental health and well-being while listening to these stories? And if you don't have sorry to put you on the spot, but I do think it's important for folks to really learn how to protect yourself as well while you're doing this research.
It is a really good question, and something that I think we have gotten a lot of leadership from on our team from two folks in particular, I would say, who are in the sociology, who are graduate students in the sociology program or sociology department here, G. Solorzano and Rebecca Schisler. And so I just want to say that G and Rebecca have really been putting this at the forefront of our team's conversations and meetings. I have a lot of thoughts about this. So one is we meet as a team very regularly, and one of the things that we do in our meetings is we do check-ins, and we don't just do like, hey, how are you? We try to be intentional about the check-ins in terms of thinking about mental health, thinking about how we're coping and what we're hearing. Then that is a part of the analysis. We also added, and I think this was either G or Rebecca's suggestion or both of their suggestions, but we added, so we write memos, we call them thumbnails at the end of every interview, and we added a section called How I Felt. And in that section, we asked the interviewer to kind of reflect on their emotions and feelings after the interview and during the interview. So it's a place to kind of start that process of how you felt, and how as a human being, it is very hard to listen to these experiences of, in most cases, trauma. We're all experiencing, there's this trauma of the pandemic, right? But then there's also all of the things that the families we talk with are going through. And so G and Rebecca have really helped us to kind of think about how care needs to be at the center of this kind of work and research. And it's something that I studied in graduate school as well, but I think it's a commitment to centering care in research, because it's a different model of doing research and being a whole human and bringing your whole human self to it, which has meant that timelines have to alter sometimes because people are going through things in their personal life, or sometimes you can't do an interview because it's too much. Maybe it speaks too much to your own personal experience. It's just been a lot more showing a lot of grace, a lot of flexibility, all the things that we're trying to do during the pandemic. But now, what would it look like if we created research teams and research protocols where we did that all the time? And so I really am thankful for everyone on our team, not just G and Rebecca, but everyone for being a part of that kind of conversation. And once it's out, I'll share it. But we just have several of us wrote a paper on our methods for the project, and that has been a piece of it, is how we're thinking about care for self and others.
Are there additional questions for Dr. Hardison-Moody? Hearing no additional questions, Let me thank Dr. Hardison-Moody for her excellent presentation today. And I would like to invite you to please join me in finding an emoji of choice to express our appreciation to Dr. Hardison-Moody and to encourage her in this scholarship and this important work.
Thank you very much. And I'm happy at any time to talk more. And I'll put my email in the chat if you would like to chat more about any of these things. And I really appreciate being able to think through this. It's given me, our team, a chance to kind of this is our first kind of preliminary results presentation. So thank you all very much.
Thank you again, Dr. Hardison-Moody. And please mark your calendars for Tuesday, October 19th, 11:45 for food safety in the time of COVID-19. Everything has changed. Also, nothing has changed. Brought to us by Dr. Ben Chapman. Again, thank you for being here. Thank you, Dr. Hardison-Moody. Everyone, please have a great week.